How are you?
Hello, good afternoon, everybody. Welcome to our January Board of Health meeting. I'm going to go ahead and call us to order. Before we go, I don't actually think we have anybody for privilege of the floor, so I'll skip over that. And before we go to the board minutes, I just wanted to just kind of introduce yourself, and then we can also introduce ourselves to you
Great,
and say welcome.
thank you. I'm Jess Thorpe Manderville. I'm the Director of Children with Special Care Needs. Previously worked with Rachel in Community Health Services as a senior community health nurse.
Well, welcome.
Thank you.
You want to just?
Yeah, sure. Sue Merkel, hi.
Hi.
I'm a microbiologist. I used to teach at Cornell, public health microbiology, but now I'm retired.
Yeah.
Ed Copel, I'm a Board of Health member and physician at One Health.
Welcome. I'm so excited that you're in this position. You know me, I'm a pediatrician, Melissa, I work in schools.
Shauna, do you want to introduce yourself real quick?
Yeah, hello. I'm Shauna Black. I'm on the legislature. Welcome. We're very glad to have you.
Thank you.
I'm Christina Moylan. I'm also on the Board of Health and work at Ithaca College for my full-time job. So, a day job. All right, so let's go ahead and take a look at the minutes. Oh, you know what? We're gonna have to skip over that because we in fact don't have quorum for that. So we're gonna go ahead and skip over that. And we'll come back to that. Financial summary, is that you for today?
I don't know where everybody
Yeah.
is.
You're missing half of the health department.
Yeah.
Party going on somewhere that we don't know
Yeah,
about.
something
We're invited.
really bad is happening when Brandon and Liz aren't here at the same time. Which one's that? Oh, there's Liz already.
There's
So the
Liz.
world's not ending. We're
Yeah.
fine.
Did you know?
Oh, and there's Brandon. There you
There's a
go.
party and Frank said something really bad.
You guys have the positive outlook. I'm the best in the group. So the financial report. Brenda isn't doing the financial stuff anymore.
Oh.
So as we've reorganized the department, Brenda has transitioned more fully into the deputy role. And so she is overseeing the divisions within this department. And supporting them, as well as continuing to oversee medical examiner program and preparedness. The financial stuff has shifted over to Jeremy Porter, who is the fiscal administrator. He started as fiscal administrator for mental health, but now that the merger is complete, he's taken over financials for both the new merged department. Jeremy is just returning yesterday from a significant medical leave and is only working part-time. So we had talked to him about coming to the Board of Health prior to him going out. He will be coming to future meetings. So that will be a shift that you guys will be seeing. What I do know is that we are in the phase where we're trying to close out 2023. And it's obviously not done yet. It takes us several months to get there. But generally speaking, I don't think we have anything to report outside of the moment.
Any questions on that from board members? Okay, Dr. Claypack.
A couple of things to add to the report that I had. I didn't address the communicable disease numbers that are in the appendix under the report, but as you will notice, the anaplasmosis, the babesiosis, and the Lyme disease numbers in the year-end report confirm what we've been talking about all through the year, that these tick-borne diseases have risen and generally quite significant. On the positive side, on the good news front, our syphilis numbers in general are better than in many previous years. And most notably, that single case of congenital syphilis that we had a couple of years ago has not been seen again. We haven't had another one. So that's all for the good. With regard to influenza and COVID, I mentioned a little bit in my report. Influenza does tend to fluctuate a bit as you go through the year, but the the trends are, as they usually are, with increasing numbers, and the specific virus types that we would expect to see are being seen. So, that's reassuring, nothing, scary coming up in that regard. COVID may be having a bit of a dip. It's not entirely clear. But it may be, this variant that I'm dealing with, maybe we're seeing a bit of a dip. Certainly, in terms of hospitalizations, we haven't seen a rise in the county to my knowledge. So that's all to the good. You have to always say though, that with COVID, it does this. So when you look at January's of the previous years, we dealt with a rise and then there was a decline. And then that went along for a while until we ran into another variant and another fluctuation. So this seems to be the behavior of it. And finally, I just would point out, this is Radon Awareness Week. This is the time of year that it's particularly a good idea to test one's home or business for radon because, it's all closed up for the winter. You close all the windows and batten down the hatches. And it's a good time to see if you have radon levels that are inappropriate. And testing kits are available. Our website addresses that. You can just go to our Tompkins County website and you can find information there. And if you do have a positive, there are there's information how to reduce it. And on the scheme of things, not a monumental task, but it is a task. But radon is radon after smoking is the leading cause of lung cancer. So it's not a trivial issue for health. Thank you.
Are there places people can get free radon test kits or is it all purchase?
There are free radon test kits. Our Healthy Neighborhoods program has them usually. And the message I heard this week was that we may still have some kits. We're waiting for some more to come in. But people could certainly call the department and at least get put on a waiting list, if not receive one. And the New York State Department of Health, if you Google radon, New York State radon kits, you'll find the New York State Department of Health will pop up. There's on their webpage, there's a application to do online to get one free test kit. And when I went through that today to make sure it was operative, it was, and they said you could expect delivery in 2 to 4 weeks.
Sam said something in the chat that I can't read. Someone closer.
Time limited promotion from the state for free tests as well. And then there's a link.
Okay.
Yeah, and I just sent these. I just sent these to Karan too, to just send that direct link to board members so that you'd have it and the link to our updated website page. But Healthy Neighborhoods does keep these kits in stock as best as we can. And so we did just get another delivery from the state, and it's great if people are interested in a radon kit because then Healthy Neighborhoods can also give all the other information and great products that they have available. So it usually turns into just that much better of a home visit. So so they're getting calls following that press release going out. Thanks, Dr. Hay, for raising it.
Yeah, and we should mention that these are available for purchase in a lot of the hardware stores and places like that. So one can purchase. Thank you.
Yeah, I was pulling in actually here, there was the commercial, the Healthy Neighborhood commercial for Whole Health, but and I don't know if anybody has heard it yet. It is really amazing. It's a very nice commercial.
On the radio?
On the radio, yeah. So, and I was really impressed by what it offered to people. And I can't remember if they mentioned radon, but I thought they did. It's a really nice commercial. And public service announcement.
Any other questions from board members? Okay, let's go ahead and move on to the shared report.
So just not really much to add other than to continue to update the strategic planning process is well underway. We've done a pretty comprehensive review of it with senior leadership and our other leadership, broader leadership team, all the supervisors. You will be getting a survey any day now to participate, as well as all staff in the department to kind of give us some feedback on that process as well. Just a reminder that we didn't do a full strategic planning process. We really did a review of the existing one. And this is, I've been describing it as a renewal process versus creating a whole new plan. So your opportunity to weigh in is still out there. And we are planning to do kind of a launching of it at our all staff meeting on the 31st of this month. And today is state budget hearing for health is going on as we speak. So Commissioner McDonald and Mr. Basari from Medicaid are talking, getting grilled right now as we speak. The state budget has some things that we like, some things that were not so much. There is an EI rate increase that's proposed, a 5% rate increase with an additional 4% for rural and underserved areas. When asked this morning how they defined that, they gave as ambiguous an answer as they possibly could. So there's still not clarity on whether or not we would fall into that. I would hope we would. So it would lead to a 9% rate increase, which is below the 11 that we were hoping for last year, which 11 wasn't even enough, but at least it's a step in the right direction. There are a couple of public health programs that are being proposed to be cut. The one that we get direct funding for is the rabies program. It would be about a $50,000 cut to us if that were to come to fruition. The response to why they're cutting those public health programs, it's a difficult budget year. We had to cut somewhere. So whether all of that shakes out at the end, this is, the first step, as you guys know, with the governor making her proposals. And oftentimes some of these programs that you couldn't imagine being cut are proposed as negotiating pieces for later on down the road. So more to be seen. But generally speaking, we don't see anything too dramatic, and certainly the EI increases would be a welcome change. There are some things that they won't be funding in EI, but Jess and her team's done some review, and it would have minimal impact on services that we're currently providing related to telehealth and group setting, some things that were put in place for COVID and others to try to help. There was a lot of conversation about the shortages across the state. So I think there's a general awareness of that issue. So we'll be monitoring the state budget as it continues through its process, and certainly let you know if there's anything that jumps out that you might want to be aware of.
If the rabies program is cut, does that mean that people who are bitten by whatever won't get covered for their?
No, honestly, it won't mean anything to people locally. It'll mean we have to take funding from somewhere else. Rabies is 100% fatal. We can't
Is
not
it covered by
pay.
insurance?
I don't know the question. Sometimes Medicaid is paying for it too. I
Super
think.
expensive, yeah.
Yeah, we do get requests when there's a situation where people don't have any of that for us to reimburse, but it's fairly rare. But in any case, it would not prevent someone from getting the treatment. And again, this funding issue would be more of us moving funding from someplace else to be able to cover it. So it's really not a cut to rabies. It's going to be a cut to something else that's going to happen.
And I did check the dollar amount's actually $63,000. I haven't updated Frank yet.
Although it could affect things like clinics and stuff like that. We are in babies program.
For the animals.
Yeah.
Great, Rachel.
Just one thing to add to my report, I mentioned some staffing. We have 2 open positions for senior community health nurses. One of them was vacated by Jess. And when I wrote my report, we hadn't yet posted those, but those were just posted yesterday on our personnel site. And as promotional and also open to the public. So would appreciate spreading the word on those positions. Be looking to hire soon.
Any questions on community health? Sam. Health promotion, yeah, sorry.
I do not have anything else to add. I was also going to mention Radon Awareness Week. So thanks.
Any questions on the health promotion report? Okay. Let's go ahead with children with special health care needs. Yes. Oh, that's I wasn't sure if they were yeah, we did. I wasn't sure if they were throwing you in.
I think they did. I think that's it. Although I don't have much to add because I wasn't in this position between November and December. I can just add that Deb Thomas is here for a short period of time to help train me in the position.
Okay. Liz, environmental health, just your updates first. Please.
There was an incident at a Holiday Inn pool in mid-December. It was a private party and some kids did get ill that was related to chlorine. With the EH and New York State DOH are doing the investigation. Don't think we'll be able to find an exact cause, but it does seem to be equipment and testing related.
Like too much chlorine in the pool?
Separate from the enforcement.
Any questions on that? All right, so let's go ahead. I'm going to, let's go, let's head into new business. And before we do the administrative actions, let me pull forward the minutes because we were waiting for quorum to share here now. That's okay. So let's go ahead and I'm just going to pull forward the approval of the minutes. So if we could get a motion. So Shauna, you're eligible to vote, but you won't count our quorum. Okay. I need a motion to approve as written. A first from Melissa, second from Samara. Any discussion on those? All in favor? Opposed? Abstentions? That one. Okay. Administrative actions. Is this you, Frank?
Didn't we elect you last time?
I thought we did. Or did we just talk about it?
Nominate. Nothing voted.
Let's relook at our minutes.
I never flew.
No, it's the first action at the next month's meeting will be the appointment. I think we talked about it. We didn't vote.
Okay, so then you would hand the gavel to me. And I would open the floor for nominations for election of the president of the Board of Health.
I'd like to nominate Christine Marlin.
Very good.
Second.
Any other nominations from the floor? All right, seeing none, we'll close nominations. All those in favor of Christine Moylan as president for the 2024 year? That appears to be unanimous. Congratulations.
Well, thank you.
The gavel is yours.
So now we'll also open the floor for nominations for vice president. So we have a first for Melissa. We have a second. Any other nominations from the floor? Oh, and a third and a fourth? Yeah. Any other nominations? Okay, so all in favor of Melissa as vice president? And that's unanimous. Okay, let's go ahead and move on to, we've got two environmental health actions today. One related to Cayuga Nature Center and then the second for the Holiday Inn Express Pool. So let's go ahead and open with the Cayuga Nature Center. So if we could get a motion to approve as written. First from Samara. Second from Sue. So Liz, any additional background on this that we need to be aware of?
The Cayuga Nature Center was previously brought to the Board of Health, so the revision of the Board of Health orders. They are not currently in operation and they are having some financial difficulties. So this order essentially removes the previous deadline for making the changes to their water system and requires them to make changes 60 days prior to operation. They are working with a water supply contractor now, so they are taking some action in the right direction. Timeline, and everything are uncertain.
Any questions from board members? Sue?
So the current plan is to reopen and have camps this summer. Is that what the goal is? So they need everything okay by then?
They are hoping to, yes, that's what they're currently telling us. They do want to hold fulfillment camp this summer, but I think there's things that have to be worked out for that.
Any other questions? Okay, let's go ahead and put it to vote. All in favor? We are unanimous. Okay, let's move on to the Holiday Inn Express pool. Can we get a motion to approve as written? First from Sue. Second from Samara. Liz, any additional?
So this is also one that has previously been a violation of Board of Health orders. Because we did do an inspection in October, but I found that the pool was in operation and in violation of the code when we had thought it would be closed. So we've expanded the order and are added a requirement for somebody to take the pool operations course as well as to be on site. They have been submitting their monthly operating reports. The person is, the designated person is taking the course. They seem to be getting on top of the situation there. But this is the orders that, because they weren't.
Any questions on this one from board members? Sue?
Sorry, is the pool open now or is it closed?
The pool is open now. They've had a clear inspection in January. They had the incident that closed, then they self-closed the pool after their incident. Then we had several visits and they did have an inspection, I forget what day, January.
But they currently don't have a pool, what is that, pool knowledgeable person?
They have the person, he's
Who's in
working, they
training.
have a firm that comes by weekly.
Okay.
Right, and the guy is taking a course for it to act, I think they meet right now. I don't know that he's completed it yet, so they do seem to be getting on top of the operational supervision. As well as some of the equipment operation issues that they.
Other questions? Okay, all in favor? It's written. We are unanimous. Okay, so the next agenda item is proposing to move us into executive session. So we do need to vote on that to move into executive session, so we'll need a first. We've got a first from Melissa and a second from Ed.
And just quickly before you vote, the purpose is related to potential litigation.
For the purpose related to potential litigation. Any discussion on that? Okay, all in favor? And we're unanimous.
All
We
right,
need to leave.
what's that? Yes, I have to, let me stop this first, one thing at a time.
Can we zoom Shauna in?
Yes, I'm not in the Zoom, I'm just ending the